Gluteal tendinopathy is a condition that causes lateral or outside of the hip pain. Here are 9 common myths about this condition. Myth number 1. Gluteal pain is related to an inflammatory condition of the trochanteric bursa. The truth is, your pain is caused by compression or degeneration of the gluteal medius or minimus tendon. Isolated bursitis only is found in 2 to 8% of the patients. Myth number 2. Gluteal tendinopathy only occurs in post-menopausal females. It is most common in this group, but it's not only seen in this group. It is seen in post-partum women, especially runners, also people with hip OA, dysplasia, or recovering from a total hip replacement. Myth number 3. Palpation of the greater trochanter is adequate for diagnosing gluteal tendinopathy. In truth, we need a cluster of tests. Palpation is one, 30-second stand, resisted hip abduction, and the Fader test. When all these are positive, you have a 99% chance of this condition. If you're struggling with this condition, we specialize it. Look at the email below to schedule an online session. Myth number 4. Diagnosis and management for greater trochanter pain should be based on imaging. The truth is, clinical examination is needed for this diagnosis and is always required to assess the relevancy of imaging findings. Myth number 5. Gluteal tendinopathy is a self-limiting condition. While around 50% of gluteal tendinopathy patients will slowly get better over 12 months with basic advice, the other half won't, which is why early intervention of high-quality evidence rehab is so important. Myth number 6. Gluteal tendinopathy is due to tight IT band, and treatment should include IT band stretches. The truth is, when we look at studies that stretch the IT band or surgically elongate it, it does not help with pain. And this is due to compression, so the more often when you stretch the hip or IT band, this is much more likely to cause more pain. Myth number 7. Corticosteroid injections is the best first-line management for gluteal tendinopathy. The truth is, these may provide some short-term pain relief, but come at long-term costs potentially, and should not be used as first-line intervention, where rehab and posture modifications are the first-line intervention. Myth number 8. The clamshell is the best exercise to address the abductor deficits in gluteal tendinopathy. The truth is, the clamshell is likely to irritate the tendon or the anterior rim of the hip joint. It actually is a very low activation of the glute med, and weight-bearing exercises are preferred and should be recommended. Myth number 9. All gluteal tendon tears need to be surgically repaired. Most gluteal tendon tears do not require surgery. Surgery is more likely to be helpful in people with substantial tendon detachment. They have not been responsive to rehab for over 3 months, a positive Trendelenburg gait,